So we're moving on. As I mentioned, we have a slight change to the programming, but now I think we have Buzz Stewart on from Medcurio, one of the amazing innovations that HITLAB has currently working with. Buzz, are you there? I see you just coming on now. There you go. Fantastic. All right, brilliant. Can you hear me, Buzz?
I can, yep.
Okay, wonderful. Well, thanks for coming on the program. I know we had a slight change, and I'm glad and really appreciate that you're able to move your time around for us. But I think it's really important that the audience today gets a really good introduction to, of course, who you are and what Medcurio is doing, which is a really important digital health solution that is going to be impacting very soon, and I think in a large way, the way that delivery is being administered in the healthcare systems. But Buzz, give us a quick 60-second sort of introduction to yourself, of course, to the audience that aren't familiar with who you are and what Medcurio is.
Sure. So before we launched Medcurio about 4 years ago, I was a R&D leader in healthcare for about 15 years, first at Geisinger, and then the chief research officer at Sutter. And we did a lot of we invested a lot of effort in trying to use data in real time because we saw it as an essential asset for improving care, and wrestled with that for 15 years and decided that a dominant barrier to really successfully doing that was interoperability. So we started Medcurio basically to solve that problem.
No, that's wonderful, and of course, the whole idea around Mercurio is really to improve the way that EHRs are functioning, and we'd love to hear a little bit from you around sort of the concept of real-time EHR data usage and the importance of it, of course, in healthcare today.
Yeah, good question. Yeah, I'm going to start with the second part of that because it's been a constant in my career, and in fact, if you're in healthcare, you hear it all the time, and it has to do with where the money comes from. So one of the constant trends is that the average reimbursement for healthcare services has and will continue to decline, and that's happening because the publicly funded share of paying for healthcare continues to increase. In 1987, Medicare, Medicaid, and other public payment sources accounted for 30% of all healthcare reimbursements. In 2022, it was 48%, and that's going to continue to go up. Historically, executives manage this problem by trying to go after the commercial insurance market because it just paid more. But that option is basically evaporated. And so now backs are against the wall, and this financial pressure, which really is a vital threat, can only be solved by substantially reducing the cost of delivering services. And I think that this is sort of a vital threat. And I think that the only way that you can do that is the way we've seen it happen in other industries, which is to use data in real time to automate work. And in healthcare, you say, well, what data are most related to all the services that we want to reduce the cost of? Because if we reduce the cost, then we have more net. And of course, electronic health record data are the cornerstone for virtually every service that we offer to patients. So they're a critical ingredients. And if you think about how you automate, what you have to do is to say, well, what does this person do? And then you have to build a software workflow that mirrors what they do. It has to have this special quality in healthcare, I think, to both be systematic and flexible. And then the critical ingredient is getting electronic health record data in real time to fuel that workflow. And I think one thing that people don't realize often is that this is really precision engineering. And what I mean by that is that the data that you're accessing has to be timed very precisely, and it has to fit the process very precisely to drive the process. And we've had a challenge, I think, in this space for the past 15 years as automation first started to emerge with the electronic health record. And it's a dominant challenge, I think, that we have to sort of solve, and that's our interest over the past 5 years.
No, that's fantastic. I totally agree with you. I mean, I think one of the huge obstacles in healthcare systems today is that sort of real-time sort of data access and interoperability, as you said, of EHR data. And can you talk a little bit more about sort of the different ways that real-time use of EHR data can actually be used to continue to improve the way that the healthcare systems are being run?
Yeah, so I would say that there's lots of opportunities to improve healthcare because there are so many problems, but there are also so many areas where use of electronic health record data in real time can really improve how we deliver care, can reduce burden on providers and nurses. And I think one of the exciting things with the emerging era of AI is the way in which it can play a more substantial role in amping up what we can do in both automating and facilitating work of others. The dominant focus of automation work with electronic health record today is mostly around offloading repetitive work. And that's already happening or has happened with billing and coding, with prescription management, regulatory compliance and reporting, to some degree, patient management, but I think in a limited way compared to what we could do. To some degree, scheduling, but not the more complex scheduling where a lot of money is at stake. And also it's limited in other areas where the diversity of the electronic health record data that are needed is substantial. So the challenge we face is as the diversity of data that you need increases, it's less likely that you could really automate that process. I will say on the front line of care, which is an area where I think there are serious concerns from work burden and burnout, we're seeing automation in clinical documentation and charting. And also finally some initial work, I think, in basket automation for physicians, which is a dominant cause of burnout. But we're at the very early stages of I think that in basket, I don't think we're doing much for physicians. We can go a lot further, especially with AI in pretty much automating the whole workflow process and offloading all that work from both doctors and the nurses who currently are getting the triage of their work. So I think that's a quick snapshot, I think, of what's going on, but there's a lot of areas where we're not yet having success in automating, and that is where the data diversity needs are pretty expansive.
Yeah, no, absolutely. Can you talk can you expand a little bit more on sort of some of the major challenges that these healthcare organizations are facing, especially when trying to use applications that are going to be requiring the real-time use of EHR data, particularly maybe some of those establishments that are more rural, perhaps than others.
Yeah, so to me, one of the exciting things is to see, and we've been watching this for 15 years, is to see how the application development space itself has revolutionized. I mean, when I first started out, it was heavy lifting, doing all the coding, and this profound transition to no-code solutions really allows you to think about the solution you want to create and doing it in precise ways. So it's exciting to see that continue to evolve, and we're seeing it everywhere. I mean, Salesforce, if you look at the kinds of tools that are available, it's stunning. And the same thing I would say in the data processing space and infrastructure space. So lots of revolutionary changes, I think, happening. The major challenge I think that everybody faces is with electronic health record data interoperability. And if you're going to automate work in high cost areas, you need real-time access to whatever data, electronic health record data, is required to precisely fit the workflow process. And it has to be accessible in a way that can be done, I think, it has to be done in sort of days or minutes and not in current state weeks or months. But one of the fundamental challenges, especially if you want to access Epic electronic health record data, is you're pretty much confined to the same tools that I used 10, 15 years ago, HL7 messages, FHIR APIs, vendor APIs, and all those related methods. And they only give you access to about 40% of the 90,000 or so data field. And it is a heavy lift to use those methods. We used those when I was at Sutter, and I would say that it was challenging and problematic to maintain applications in production. We actually were among the first to switch to hiring cache coders to build APIs so that we could get any data that we needed. But if you've ever tried to do that, it is expensive and time consuming. And I always say that there wasn't a deadline that we didn't violate or a budget we didn't violate because of the difficulties in trying to access data in real time. And we concluded that if we're having trouble and we're in the first position, then the whole market is going to have problems with these limited tools.
Yeah, no, I mean it's always difficult to make any kind of changes to any systems that already have been in place for so long. So it's great that you guys are sort of behind this sort of charge to make sure that we really have effective interoperability within these systems, which is super important to both the physicians and the healthcare providers as well as the patients, of course. And just to round off, Buzz, this conversation, we'd love to hear a little bit more around the technological advancements that you've seen that have really made a difference in real-time EHR data, and how that's made it more accessible and of course, and more importantly, usable as well.
Yeah, so as I mentioned earlier, there have been, I think, lots of advances for using data in real time, from data management and processing infrastructure, real advances there for fast processing, low cost processing. The orchestration technologies have been critical, I think, to help manage more complex processes. So I think there's a span of new technologies that are right for the time, especially with the emergence of AI. But in general, if you're in the healthcare space and you're trying to focus on facilitating or automating work on the direct service side, if you can't get access to the electronic health record data you need to fuel an application, that infrastructure doesn't matter that much because you can't get the fuel to it. You can't get the precise data to drive processes. And that's why we left healthcare to reinvent electronic health record interoperability. What we've developed is a platform that I wished I had when I was at Sutter, which is a no-code API platform. It takes a couple hours to install in a health system, and it gives an analyst point-and-click capability, basically, to build APIs to access any electronic health record data they need, and they can build and deploy those APIs in a couple of days. They can modify them in minutes. As fast as you're changing the front end, you can now modify the back end plumbing. And it's highly scalable for health systems, often that have multiple instances of an electronic health record. You can build once and export to those instances. And there are other features of our technology that I think are exciting and certainly relevant to the needs that health systems have for automating data, but this automating processes. So I think that the technology that we've developed is a cornerstone, I think, for health systems to begin to better use their investment in their data asset and have full control of it in a way that I think makes sense.
No, that's some really, really excellent points there, Buzz, and I'm sure there's many more that you can certainly make, but we are at time with our session. But really appreciate you coming on, sharing your insights around real-time EHR data, and also telling us a little bit more about Medcurio. And we're really looking forward to seeing how Medcurio continues to develop and really make a difference in today's EHR applications in today's systems, Buzz.
Thanks for having me, Jerry. It's great to be here.
Thanks so much.
Right.
Well, awesome. Everyone, please do check Buzz out. We did put his LinkedIn details in the chat. So if you are, wanting to continue that conversation around the challenges of the applications of EHR and real-time data in today's healthcare system, Susan, I see you in the chat and Mark having a lively conversation there. Please do reach out to Doug. I'm sure he'll be more than happy to continue that conversation, and check out what Medcurio is doing. It's really, really fascinating, the way that they are leading this charge into really improving the interoperability in today's health system. So thanks so much, Buzz.
Thank you.